So let me guess. You've been told nothing can be done, give it 6 months, your brain will get used to it. What am I talking about? I'm talking about your eye floaters. These moving shadows and clouds and fibers and threads moving around in your vision that's driving you a little crazy. And why is it that your local doctor has said nothing essentially can be done for them? Hi, I'm James Johnson. I am an ophthalmologist, and I am also known as the floater doctor. I have been exclusively treating eye floaters since 2007 here at my office in Southern California, in Irvine. So you've gone to your doctor, they've done their dilated exam, they've looked at your retina, they've reassured themselves and hopefully you that there's no retinal holes, tears, detachments, everything looks fine as far as they're concerned. They're done. They've checked out, they're moving on to the next patient that they can do cataract surgery or something else on. That leaves a few of us who have any significant experience treating eye floaters. At some point there's been maybe 3 or 4 of us in the country. I am, by the way, the only one in the world who does this exclusively. This is my medical practice. But what has changed in the last 3, 4, 5 years is that the company that makes my laser has been marketing the laser to ophthalmologists as an additional income stream for your medical practice. So they're promoting 100, 150, 200 doctors throughout the world as floater treatment doctors that you can go to. And it is awfully tempting that you, the floater sufferer, might find somebody in your home area, Houston, Denver, the Bay Area, New York, wherever, who claims to be treating floaters. Let me tell you this, let me advise you, you do not want someone who just dabbles with treating eye floaters. I've seen patients coming to me with essentially no improvement, treated by the others. I've seen people with complications where their lens was damaged. And you know, the reality is this is something that takes a lot of practice, At this point I've treated thousands and thousands of patients. I have probably 14, 15 million individually aimed and fired laser shots at these floaters, and I'm still challenged by the difficulties of it. Everybody who walks into the office has a different set of situation, different optics, different psychological profile, different expectations, different types of floaters, and you need to be able to meet and greet each of these patients with all of the skills you can draw upon to try to make it better. The good news is people are finding me, they've been coming here for a while, and I have improved the quality of vision and quality of life for many, many of these patients, and for that I take great joy. So it is incumbent on you, the floater sufferer, to do your due diligence, do your research, read about these other doctors, but take the time and read through my website. I've got a lot of information in there. I've got information about the technical aspects of it, the laser physics, expectations, risks, fees, everything, logistics, what to expect of treatment. Read through all of that. If you have a special situation or your questions simply are not answered there, you can contact me through my website. On the front page is a contact form. That comes to me directly as an email. I'd be glad to answer that for you. I'll give you a call if we need to, if it's a bit more complex. And ultimately, I'll look forward to seeing you here in my office in Southern California, and hopefully we can take care of those floaters for you. All right, so thank you for taking interest in the practice. Do your research and call and make an appointment when you're ready. Thank you.